My name is Teresa Campbell. I had burning, itching, swelling that was in my legs and my feet and my ankles.
Most patients who seek help for their vein disease think that veins are going to make their legs swollen and red and dark, and they'll have big veins popping out of their legs, and that's not completely true. That's actually a sign of having advanced venous disease. And so when vein disease begins, most patients start experiencing pain, heaviness, aching, burning and itching in their legs after they've been standing on their legs for several hours. The swelling comes next, and then later on, after having decades of vein diseases, do the skin discoloration, ulceration, etc. start.
I did do the compression stockings. They did help. I'm still wearing the compression stockings, especially when I'm standing on my feet for long periods of time.
Teresa presented with classic symptoms of what's called venous reflux or venous insufficiency, and this happens when there's failure of the valves in the veins of her legs, where blood would pool and accumulate in her legs, giving her aching and heaviness and itching and burning by the end of the day. The initial step for evaluation is an ultrasound. We perform all our ultrasounds in our offices, and that's what helps us diagnose that does somebody have leaky veins, and do they have what's called vein valve failure, and that's the reason for their symptoms. First treatment is, of course, compression stockings. Compression stockings help symptoms, where in Teresa's case, she had already tried them and she already had continued symptoms despite months of wearing compression stockings. So what we did do was we did a very simple procedure in the office, and it's called radiofrequency ablation of varicose veins. Again, this is covered by most insurances, and it provides a very good symptom relief for patients who have varicose veins and venous insufficiency and symptoms from that. The procedure involves about 30 to 45 minutes in the office. It is minimally painful, so a few needle pokes, and involves us using what's called radiofrequency, a catheter or tube that heats up and closes the leaky vein, and thereby we can redirect the blood from the leaky vein to the deeper veins in the leg, which then carry blood back up to the heart, relieving symptoms of heaviness and pain and also swelling.
The procedure was not painful at all. Dr. Bala did explain the procedure, the recovery time, exactly what I needed to do prior to the surgery and after the procedure.
I'm really proud and happy to report that the vein clinic at Orion Medical is one of the very few institutions in the city of Houston that now offers a revolutionary and newer form of treatment of varicose veins. Typically, this earlier treatments were what we call endovascular heat induced, and what that was we would use heat to either laser or radiofrequency to close these leaky veins. We now have the option of using something that's similar to superglue. So instead of heating the vein and causing it to close down, we actually can glue the entire vein down. The procedure is known as VenaSeal. There are only a few places in the city of Houston that offer this technology. Advantages are that 1, it's quicker. 2 is that there is no pain, no bruising. And 3 is that the post-op recovery is almost instantaneous. There's no compression stockings, no bruising, none whatsoever, and most patients can go back to work right after their procedure without having to lay in bed at all.
I feel the procedure was very beneficial. I'm not experiencing any of these symptoms that I had prior to the surgery.
So accreditation of vein clinics is something new, and with the number of physicians and number of vein clinics in the Houston, we at Orion Medical want to stand out as being one of the best, if not the best, in the city of Houston. We are in the process of obtaining accreditation as an accredited vein center, and that would provide patients the reassurance that we've achieved certain quality standards for ultrasound, for procedures, for follow-up, to be able to provide them the best care they can seek anywhere.
I would definitely refer Dr. Bala. He is a great surgeon. He's got a great bedside manner, and yes, I would definitely refer anyone to him.